Life is busy, so I'm going to keep this video recap as brief and to the point as possible. And if you want to go deeper, then please read the Relaxed Birthing booklet. 1. Women's bodies were designed to birth babies. That's right, that very same orifice that got you in this position was designed to let your baby out. And it's absolutely amazing. 2. Birth is natural. It is normal for your labour to shift gears, start and then stop, speed up or slow down. There's no right way to labour, but staying relaxed will help your experience be right for you. 3. Birth is about family. It doesn't have to centre around science, anatomy, doctors, midwives or nurses, although they're great. You don't need to be a perfect patient to give birth, because your trusted caregivers are perfectly trained to fulfill those roles. 4. Birth is collaborative. It's about remaining relaxed and able to communicate so your knowledgeable maternity carers and support people can effectively encourage and guide you as you become a parent. And 5. Childbirth doesn't have to be excruciatingly painful. I mean, most people know that birth usually hurts, at least the first time you do it, but not many people know it's a different sort of pain to injury. Labour is intense, but the discomfort and pain is intermittent. It's experienced differently by every mother and rarely causes lasting damage to your body. And if you can reframe discomfort and pain as a temporary part of nature, you'll give yourself the freedom to experience and react to labour in a way that feels right for you in the moment. Let's get straight into it. Your amazing, life-giving uterus is the legendary organ that will expel your baby out of your body using 2 main layers of muscle. The outer layer has strong vertical muscles going up and over the top of the uterus. These contract in a wave-like motion to nudge your baby down, whereas the inner muscle layer has horizontal circular muscles thickest at the opening of your uterus, the cervix. And as you labour, these ones need to relax, thin and open, or dilate to allow your baby to pass through. When you are comfortably relaxed, your outer vertical muscles naturally draw back your inner horizontal muscles. This is a contraction, or labour sensations, as we will refer to them. Now let's talk about your mind, which is equally as important as your body during birth, because keeping a calm mind is integral to staying relaxed. Your nervous system is triggered from your brain and has 2 basic modes. The first, rest and digest, or feed and breed mode, is the good guy, keeping you calm and well. On the other hand, when you feel stressed, frightened or startled, your fight, flight or freeze mode takes over. This is your body's defense mechanism and closes arteries going to organs not essential for survival. Unfortunately, some women's instinctual response to labour is physical and emotional stress, triggering their fight, flight and freeze mode, restricting blood and oxygen flow to the uterus, causing tension, unwanted resistance and increased pain. And labour can be slowed, stalled or stopped altogether. So fear plus stress equals tension, and that is bad news for birth. But the good news is fear and stress can be neutralised through gaining realistic knowledge, a positive mindset and harnessing relaxation. Another reason the mind-body connection is so very important during birth is because the inner circular muscles of the uterus worked as a sphincter, and they can be temperamental at times. But there are several ways you can help them open. Sphincters function best when you feel safe, like in a room with a closed locked door, or a bathroom or a bedroom, or just somewhere where unwanted interruption is unlikely. Sphincters cannot be forced open at other people's command. Instead, you need supportive caregivers that encourage you. Sphincters may suddenly close down if you become upset, frightened, humiliated, or self-conscious. So it is important for you to be cared for by someone who you trust and have someone close by who you love, as trust and love assist relaxation. Now, actively relaxing your mouth and jaw can directly help the cervix, vagina, and anus to open to full capacity. So avoid clenching your jaw and instead relax your mouth and throat muscles. A great way to do this is by letting your sounds and sighs out, especially low-pitched moaning or orgasmic sounds taken from your throat and directed towards your bottom. Laughter can promote the release of pain-numbing happy endorphins. A smile is good, a chuckle is better, and a good old belly laugh is one of the most effective forms of anesthesia. Slow, deep abdominal breathing aids the opening of sphincters, is relaxing to the body, the heart, the nervous system, and the mind. In fact, let's dive straight into relaxation and how to harness its power.